Welcome to the American Institute of Healthcare Professionals Videogram on dealing with a loved one's terminal diagnosis. And in this video, we're going to look at some initial responses that come from this bad news, but also some things that we need to really reasonably and intellectually begin to consider when this occurs. So when the first news of a terminal diagnosis is given by a physician or from a lab test, this unfathomable news that a loved one either has cancer or terminal illness, that it is a literal nightmare from hell. In many ways, one becomes like a deer caught in headlights. They're unprepared, because no one wants to think that tomorrow is going to bring the news that it's going to change forever one's life. No one's prepared, no one's ready. Everyone is stunned. Reality crashes into this unbelievable nightmare that this cannot be happening, or this couldn't happen to me, it happens to others. But here we have it. We have someone who we dearly love having a severe illness that in all reality has no cure. And there is a time frame now given, a ticking clock before the arrival of the angel of death. So chaos and confusion are going to erupt as emotions flare. Now, in a previous video, very intimately connected to this is AIHCP's Facing Death video. And we discuss in great detail Kubler-Ross's model of terminal ill patients, not just the terminal ill patient, but also the family of the terminal ill patient regarding denial, anger, grief, bargaining, and acceptance. And we talk about the spirituality or lack of spirituality that can come under attack in these moments, or maybe someone might find God in these moments, or they might lose God in these moments. But despite Kubler-Ross's diagram of these phases, our emotions in reality don't just go from one to the next, completed, to the next, completed. It's in fact a dance of oscillation between ups and downs, back and forths, where we're constantly thrown back to this emotion or to a different emotion in itself. And that's because the thought of losing one's loved one is so unbearable, and it can hit one like a sledgehammer. So we might deny at first, be angry, be sad, then deny again, oscillate with intensity, have moments of clarity, and then again go back into just a profound and intense sadness. And again, an intense sadness that makes one question faith, God's existence, or if you do not believe in God, one's own paradigm of what existence is supposed to be. Now, throughout this intense grief, there are decisions. There are things that need to be done. Some can, some cannot. So who can make the decisions for this individual? Obviously, most have living wills that designate a power of attorney, or if, God forbid, it's a child, or if it's a parent. Certain family members obviously have certain legal abilities to make decisions. So within the family, who is the emotional rock? If a child is dying, it would be the husband or the wife. Who is going to be able to be clear enough, despite their intense pain, to think clearly and concisely in many of these decisions? Who's going to be able to do it, and who isn't? Second thing is the medical procedure and terminology, understanding the procedures that are suddenly being thrown at you, things that seem so foreign and distant, terms that may have never been heard. Who's going to ask those questions? Wanting accountability. from the physicians and the healthcare providers who are performing these procedures. Having a balance between being a bedside doctor and also a concerned parent or sibling or a concerned adult child. Because many times healthcare providers do something wrong. And we have to trust them to an extent, but where is that balance and that wanting of accountability that the right decisions are being made right now for this terrible situation that has just occurred? Part of that also involves educating oneself, asking questions from those. If you know anyone who knows someone that's a professional, not just being swept with everything, but becoming involved. And best plans and medical options, okay? There's a variety of medical procedures. There's also studies for those in cancer. There's various oncology studies that one could be part of. If you know where to contact, what institution to contact, who are the best specialists? Do you just want to work with your local hospital, or is there a far more better facility? And how far is it? Then you start to weigh together the risk and the reward for certain procedures, the price of certain procedures. Hospice itself. Is hospice an option at this moment, especially if it's a terminal ill? So there are so many numerous questions and things to weigh when making the best plans and medical options after one comes to a understanding of what is going to occur. Now, does this mean when one makes these plans and options that one automatically gives up all hope? No, we must always have hope. But we have to understand the direness of the situation. One has to understand what's being done, what can be done, who else is out there, and manage the risk and reward. Is something that I'm willing to put my loved one through have a high percentage or a low percentage of working? Is it extraordinary in that it's new and has low success rate? Or is it more of an ordinary thing that has a good chance to give a good resolution, at least temporarily? The hardest decision, though, is quality of life versus quantity of life. So as one sits there realizing that their loved one has an inoperable or incurable cancer, and the doctor just said you have 3 to 6 months left, and you've examined all these procedures, you've cried in between them, re-examined them, looked at all the options. What is the final conclusion with you and the various family? Is the various treatments going to increase one's life, but totally through maybe radiation or chemo destroy this person physically and make their final years, their final months or days or weeks far worse? Or is it better to give them a quality of life, a hospice plan, to come home and to allow the natural effects to take place? And that's a hard decision because no one wants to give up on a loved one. But sometimes the quality of life can be the best decision, especially if it's inevitable. And these are not easy decisions to make, nor decisions that anyone would ever be envious to have to make regarding a loved one. Of course, it does help if the loved one who is going through this has some input, but sometimes they cannot if they go through certain procedures. And it's totally falls upon the weight of you to make that choice of quality of life or quantity of time, judging these procedures. Now, while you're making these decisions, while you're determining what to do, there could be a domino effect of secondary losses. Financial, hospital, and expensive medical costs can add up and have heavy financial burden on the whole family, especially if there's not enough insurance. Sometimes there are various fundraisers that can be accomplished through friends and family. Relationships, so many marriages end after the death of a child. The partners blame each other and they drift away in grief. Maybe they don't understand how the other grieved and they don't consider one grieved enough or in a certain way that they did. And it just tears the family apart of making certain decisions or certain guilts. And also other children, the siblings can feel very neglected. And in those years of terminal care for another child that dies, the other child goes to the wayside, gets into trouble, is not watched as well, feels envious and jealous because of this lack of love. And maybe they begin to, in an imperfect way, but nonetheless in a sincere way, begin to resent the other sibling because of what has been taken from them, even if it's at a subconscious level. Or maybe they have imaginary fears that they said they hated them a week before the individual became diagnosed, and they think their words had this magical power, and they keep this guilt and no one talks to them. So it's important to communicate with the other children, to let them know they're still loved, to give them time, to involve them in the process as much as possible to understand, because the child's mind works much differently during the grieving process. So unfortunately, there's not a happy ending to this particular story. It's a terminal diagnosis. And most times terminal diagnoses lead to the inevitable death of a loved one. There can still be hope, but for the most part, it's a death sentence. And how we carry ourselves with our loved ones during these final valuable weeks, months, years is critical in helping them prepare and to make the best choices available that we know at that time, and not finding guilt later because we may not have made the right choice with the information we had at the time, but moving forward, and then still possibly dealing with secondary losses that come from that. So it's a rather somber ending to what we discussed, but it's an unfortunate reality. So it's important to try to do it as proper as we can as we go through it and reflect on it. We offer here a grief counseling certification. There's the link. We also offer a pastoral thanatology certification, which deals with helping the grieving who are experiencing dying of loved ones or themselves. Our email is info@aihcp.org, and our phone number is 330-652-7776. If you're experiencing anything like this at the moment, you have my condolences and prayers, and I wish you the very best in having hope, but also finding the best of the time that remains. Thank you and have a good day.